Hello, my name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana. You've seen me on these updates now for the past few months in conjunction with the leadership of the ACOI, and I hope that these messages are helping you keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As we are facing this once-in-a-lifetime global battle, I want to hear from my colleagues who are experiencing the fight from their locations. No matter where you are in the country, I provide my contact information at the end of each update, so please listen for that, and I hope that you can take me up on this invitation to reach out. Moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. Also, for more information on the ACOI's new peer-to-peer well-being check-in, please go to the acoi.org/COVID-19 and click on the box so you can find how you can join in. These Zoom sessions are an awesome way to feel connected and supported during this challenging time, and of course this is free to all ACOI members. So let's talk about our first story, and that is that coronavirus may actually be a blood vessel disease. So this is really interesting. So as we gain a greater understanding of how the virus works and what the full spectrum of the disease is, some really interesting advancements were published in the scientific journal, The Lancet. Now, a team of scientists discovered that the SARS-CoV-2 virus can infect the endothelial cells that line the inside of blood vessels. Now, these are the cells that protect the cardiovascular system from releasing proteins that influence clotting and ultimately affect the body's immune response. Now, according to the study, people with COVID-19 are showing damage to endothelial cells in the lungs, the hearts, the kidneys, the liver, and the intestines. This research actually explains a lot as to why ventilating patients, as is typically done for severe breathing issues with the flu and other respiratory illnesses, is not as successful as it ought to be. Now, at the beginning of the pandemic, we naturally fell back on the tactic of using ventilators to assist people who were having difficulty breathing. At that time, we didn't realize that this virus is actually creating clots for some in the pulmonary capillaries, where obviously oxygen exchange between lungs and blood vessels occur. So if clots are present, they are blocking the ability to ventilate. Now, this new information helps us further understand why we started seeing some mysterious symptoms of the SARS-CoV-2 virus that are not typical of respiratory infections, like painful red or purple toes, or the increasing number of cases of strokes and blood clots that we've been seeing in young individuals. In fact, researchers believe that infection of the blood vessels could be how the virus makes its way through the body and infects other organs, another behavior not commonly seen in respiratory infections. Now, the study also provides some connection to how COVID-19 is being expressed in some children as multisystem inflammatory syndrome, which is similar to Kawasaki disease. So, if it does turn out that this is a vasculotropic virus, then maybe antiviral therapy may not be helpful, and possibly ACE inhibitors may be a better choice, which will ultimately alter our approach in treating COVID-19. Of course, this still needs a lot of studying, and certainly that's not a choice. Please consult with your local infectious diseases physician as to the best choice if you do have a COVID-19 patient. But I have been following this storyline because I actually believe that there is something more than COVID-19 than just being a respiratory virus. And it's stories like this that I think really support that assertion. So for our next story is how COVID-19 has struck mostly low-wage workers. And as we often do in trying to understand a new disease, assessing the demographics of who in our population is hardest hit is something we strive to really wrap our heads around, which is why a study that is coming out of San Francisco is especially interesting to me. One of the largest coronavirus testing studies in the nation, this study involved a 4-day blitz at the end of April where 4,160 adults and children in the heart of the Mission District in San Francisco were tested for COVID-19. This is where some of the city's most densely populated and heavy neighborhoods of Latinx individuals. Now, the results that they found from widespread testing were kind of, quite frankly, very surprising. About 2% of people that tested positive for the coronavirus. About 2% of all that were tested positive for the coronavirus. And nearly all of them, 95% of them, were Latinx. The other 5% were Asian or Pacific Islander, and though 34% of the TRAC's residents are white, not a single white person tested positive. I should mention that 58% of that area's population is also Latinx. Now, one of the motivations of this testing was to understand how the virus was being transmitted, especially since the city had been locked down for 6 weeks. Along with the nasal swab and blood test, they administered questionnaires which helped them discover that the virus transmission came down to who was out and about in the community and who was not. Now, approximately 90% of those who tested positive were people who aren't able to work from home. Most were low income, and most live in a household with 3 or more people. Also uncovered in the study was that 53% of those who tested positive were asymptomatic, which means they likely transmitted the virus to others without realizing that they had it themselves. These individuals were restaurant workers, delivery workers, custodial and construction workers. So it makes me think again that our most at-risk populations for this are the most economically vulnerable in terms of not having the types of jobs that afford them the luxury to work from home and be socially distant. Unfortunately, these are often the same people who don't have health care insurance or have likely suffered from decades of inadequate attention to their health needs, which means that they may have more underlying health conditions as well. These are the people we are relying to help us stock our grocery store shelves, get our deliveries to our homes, as well as work the behind-the-scenes jobs that help all of us stay safe and distanced in our own homes. Ironically, those individuals involved with those activities that support all of us are those that are most exposed and are most at risk. In my opinion, these essential workers, these frontline workers, the ones that we ask to go to work without effective PPE or protection, these are the true heroes of this pandemic. So in conclusion, please stay on the lookout for these regular updates, and to read more from the sources that were used in this report, please go to the acoi.org/COVID-19 website. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. As always, please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.